Smith and Dan Pope on the Weather Porch.
Hearing loss is a serious medical condition, but fortunately, new technologies allow doctors to screen infants just hours after they're born.
It's really amazing. It's called Universal Newborn Hearing Screening. And tonight, our Dr. Mobley reports on a child whose life was dramatically changed when his hearing loss was caught early and doctors were able to perform a modern-day bionic ear surgery.
Barb, Randall, you'd never think about doing this without the proper ear protection. Hearing is one of our most important senses. Every year in the state of Utah, thousands of new babies are born, and hundreds are actually diagnosed with hearing loss. But new research from the University of Utah shows that many of these babies are not getting the appropriate follow-up, and the consequences can be serious.
Meet Chance. At first glance, Chance is like any normal 5-year-old. But just a few years ago, things weren't so normal when his parents discovered Chance was severely deaf.
I thought, as a parent, how could I have missed that? There wasn't any blatant sign. It was more of, we noticed that kids his age were saying more words. Chance was making as many attempts, but it wasn't as clear.
Chance's hearing loss was picked up on a childhood screening test. Since 1999, hearing screening for all newborn children has been mandated by state law. This screening helps identify nearly 100 children each year with hearing loss that would otherwise go undetected.
If you can identify and treat a child by the time they're about 6 months of age, they'll tend to do a lot better.
Dr. Park and his team at Primary Children's say that the state screening program is quite effective. For those children who fail the test, getting appropriate medical follow-up is critical.
And I think it's very important that additional testing be done and done relatively early. I would recommend, and this is pretty much consistent with the guidelines, is to then seek out a pediatric audiologist.
Through early testing, Chance became a candidate for a cochlear implant, a modern-day miracle for those with severe hearing loss. By introducing a very small electrode into the cochlea, the implant is able to convert sound waves to electrical impulses, allowing people like Chance the chance to hear again.
The cochlear implant, just from what we've seen so far, you can see, hey, you know, he's going to be able to reach his potential.
The most important thing to remember about universal newborn hearing screening is that follow-up is the key. Many of these children will go on to be diagnosed with normal hearing. Some will need hearing aids, and even some will need cochlear implants. But talk with your pediatrician. Make sure you're getting referred to the appropriate specialists. From ABC 4 News close to home, I'm Dr. Stephen Mobley. Randall, Barb, back to you.
All right, thank you very much, Stephen. Now, if your child has failed their newborn hearing screening test, make sure your pediatrician is aware so that further evaluation can be performed. As Dr. Mobley said, follow-up really is the key. And for more of the latest health news, tune into the Dr. Mobley Health Hour every Saturday on 570 a.m. from 1 to 2 p.m. As the